Many patients want to know what to expect the night before surgery and also, the process that's happening the day of their surgery. So the night before surgery, or usually the day before surgery, one of our nurses will be calling you. They will go over what time you need to arrive for your surgery the next day. That's usually 2 hours before your surgery. So we'll have you arrive 2 hours before your surgery that morning. When we call you the day before, we'll also kind of go over what time you need to stop eating and drinking, which is usually 8 hours prior to surgery. We'll also make sure you have stopped all medications that we went over during your pre-op visit. Usually those medications include you can't take anti-inflammatories for 7 days prior. If you're on a blood thinner, we want to make sure that you've stopped those types of medications. So we'll call you the day before and go over what time to arrive, where you need to check in, and again, make sure that you have stopped all those medications that we had talked about. The morning of surgery, you'll check in to whichever location you're having your surgery at. You'll get admitted to the pre-op area. And in that area, the nurse will come in, she'll check your vital signs, they'll start some fluids. They usually give you some pre-op antibiotics before surgery as well. And then the anesthesiologist will come in as well. They'll meet with you, they'll discuss whether we're gonna do a general anesthesia, a spinal anesthesia, and a lot of times that's what we discuss in your pre-op too, kind of the options between a general anesthetic versus spinal. So you'll meet with the nurse, the anesthesiologist, and then Dr. Easton will come in. He'll come talk to you. He'll see if you have any last minute questions about surgery. He'll mark the appropriate leg that we're doing. And then we'll roll you back to surgery. And then after surgery, you'll go into the post-op area where again, you'll have a nurse. They'll make sure your pain's controlled. They'll make sure you're comfortable, you're feeling okay. After that, you'll go to the floor and there you'll be greeted by another nurse. Dr. Easton will also come check on you after surgery to make sure you're fine, pain's controlled, everything went well. He'll talk to you about the surgery. We can talk with your family, and then we'll start physical therapy the same day.